This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Hey guys, welcome back to the Optimal Wellness Podcast. My name is Cassidy Waters, here with Dr. Fetters. Thank you for your patience with our hiatus with the holiday. This episode, we decided we're going to cover just some summer topics. So the biggest thing in summer, I feel like, is people want to talk about skin protection. There's a lot of buzz on the internet, right, about, okay, is sunscreen good for you? Is it bad for you? How bad is the sun actually? So I think we just thought it'd be a great idea just to cover it all. So to start out, we're just going to go over basic knowledge about your skin and how to protect yourself from the sun. So my first question for you is, what is the big deal with the sun? Why is it so bad to get the sun on your skin without any sunscreen?
Right, because the sun produces radiation. And as we know, radiation is not good. Ultraviolet radiation.
Gotcha.
So you don't want to age your skin. You don't want skin cancer. I mean, those are the two big fears that people have. And that's what is a major cause.
Yeah. So when talking about protecting yourself from the sun, you can look at the UV rating, things like that. And that's just what you covered. That's the radiation level. That makes more sense. So SPF, what does that look like? When you're looking for a sunscreen, what kind of sunscreen should you be looking for?
Yeah. So, obviously there's chemical and natural, and I prefer natural.
Sure.
As you know, even when I was in med school long ago, they would talk about, yes, sunscreen protects you from burning, but does it really protect you from getting cancer? Right. And many studies have shown it actually helps increase the risk of cancer. And just think about it, there's a ultraviolet radiation is hitting a chemical, and there's going to be a chemical reaction to neutralize it. And actually, so free radicals, what causes oxidative stress and damage, and a lot of these actually increase free radicals. So that's why I don't use chemical sunscreen under any circumstances.
Yeah, I've heard so many people talk about that, like you shouldn't use certain sunscreens, things like that. So I've heard a lot about mineral sunscreen.
Right.
Is that more of a holistic approach then?
So the good news is, back my father, his face was white. It was a white thick, which was zinc oxide, which zinc is very, as you know, it's healthy for you.
Yeah.
But now they have it micronized, so now it's invisible. And they even can use natural tint, so it's actually can be like cover up. Yeah. So there's no excuse to not wear sunblock because people cannot tell you're using it.
And zinc oxide is basically like diaper rash cream.
But they made zinc, but zinc is a mineral, and the UV light can't go past it. It's zinc is an antioxidant, so it is like the perfect sunblock. Yeah.
Okay. So if you're at the grocery store, the pharmacy, what are you looking? Should you even look there? Should you go on Amazon? Or
Amazon's always easier, but still, Whole Foods and all the natural stores. And if you want to support your natural store, I think that's great. And even talk to the people that work there. But there's many high quality ones out there.
Okay. And then, so does the SPF number actually matter? Like, what does that mean when it says SPF 35, SPF 50? What does that mean?
Yes. So if the number's 15, you can be out in the sun 15 times longer before you'll get a burn. So usually you want to be at least 30. Most experts say after 30 doesn't really matter, but you want 30.
Yeah.
The big thing is if you go swimming, no matter how good it is, and it says it's waterproof, which you wonder what makes it waterproof. So after you swim, you should reapply.
Yeah. And as far as like children's sunscreen, sports sunscreen, adult sunscreen, is there really a difference there? Or is it really just...
When it comes to natural, no. Okay. I mean, because the chemicals, maybe they might reduce the amount of chemicals for the children. But for our world, since we use natural, healthy, safe products, then I would say it does not matter. Other than just still, the earlier you have a sunburn, the more likely you're going to have cancer from that. So you want to protect your kids as well as possible.
Definitely. So when you're looking at the weather for the day, I do this every morning before I take my kids out for a walk or let them play outside. I always look at the UV rating, and I've seen on the internet, like 3 and above is when you want to do sunscreen. Mm-hmm. And then they say if you should limit your sun exposure past, 7 or 8.
Yeah.
Does that really matter? Does the UV rating really matter?
It does matter to some degree. And also the rule of thumb is when you stand up, if your shadow is longer than you, then you're probably safe. But when there's the shadow shorter than you, then you need to have protection. So most of the time I work inside, but when I go outside, if it's during the main area of the sun, that I just protect myself. Yeah. I know it looks nerdy, but I've got my wide, even though it's more stylish, wide brim hat. So my dad always had a wide brimmed hat, wear my sunglasses, on the face, you want to do sunblock. But, when I'm outside, I I'm covered up.
Yeah.
I mean, when you're fishing, and I tell people, it's like when you go to see people walk in the desert, how often are they in their bathing suit?
Right.
I never. I mean, but it's warmer when you have light colored skin and let the sun, let your shirt reflect the sun. It's actually cooler to have protection. So I feel better when I have protection. There's light, tight weave, cotton clothes that are very protective and comfortable.
Yeah. Well, I mean, you see, construction workers, people doing landscaping, they're always wearing big hats, long sleeves. So as far as skin protection in general, outside of the sun, are there things that you can take, supplements that you can take? I obviously know water is a huge part of keeping your skin healthy.
Sure.
But you hear so much about collagen. That's like such a big buzzword in the skincare. And I always laugh because you can always tell women, especially that are under 30, because they don't they're in the sun baking. And then every woman over 30 has got the big hat and they're trying to protect themselves. And it's I found pictures of my mom who was out like Bo Derek with the cornrows in the 70s, laying in on the beach. And it's funny how that time is different. But as far as supplementation, are there things that you can take to support your skin health just in general? Sure.
Antioxidants, because you're worried about oxidative stress. So antioxidants. So, vitamin A, B, C, E, selenium. There's other natural products. Picogenol is one of the most powerful antioxidants.
I haven't heard of
picogenol.
Okay.
There's many out there. CoQ10, glutathione is one of the most powerful antioxidants. So you can take natural glutathione, or you can take NAC, which helps your body produce it. So basically, a broad spectrum, complete mineral and vitamin pill should cover pretty much all that.
Okay. And is there even something that really does fight aging, fight wrinkles, fine lines? Is that even something that
the more healthy your body is, the healthier your skin. I mean, that's why you go to your class reunion, or maybe you're so young, go look at your parents' friends. And you can look at your parents' friends and tell who's the smoker, who's the drinker, and who does both. I mean, your body's aging not just internally, but externally. Yeah. And so I have, friends that look like their parents, and I've got some people that protect themselves since they're young, and 70-year-old women that still look like they're 40.
Yeah.
Yeah, and it comes within.
Yeah.
Drugs, alcohol.
Sure.
So I mean, how do drugs age people? The oxidative stress from drugs. Yeah. And people that take narcotics chronically, I mean, it's horrible for their body.
Yeah.
Because narcotics have massive oxidative stress to the body.
Yeah. Well, and correct me if I'm wrong, it's especially the elasticity, the appearance of your skin. If you're drinking alcohol, eating a lot of processed foods, your cell turnover is lower, which is causing that. Cause that.
Right. And just you're eating toxins is terrible for you. Toxins stop your body from healing. It's all bad. So, the more, I don't think it's boring because I like being outdoors and doing fun things. So if people feel they need drugs and alcohol, it's like, man, they need to get help and find a way to enjoy life and what's their purpose. Yeah. And those things.
Yeah, definitely. Before we move on to Lyme, is there anything else?
I just think ahead. In my car, I have my wide brimmed hat because you never know. You get some time off and you get to go outside. Yeah. So I have sunblock in my car. I have my wide brimmed hat. I have a long sleeve shirt. So you never know when you get an opportunity to do something fun outside. So I just be prepared. Yeah.
Well, and I think that's the thing too, is it's almost like people want to scare you into not going into the sun. And it's like, no, sunlight is so great for you, especially in the holistic community. They talk so much about going out and getting sunlight right when you wake up, right?
Look at the depression. At the equator, it's almost unheard of. The further from the equator, the greater the rate of depression. Yeah. And that's why, if there is sunshine, you should want to take advantage of it.
Right. When you do get out first thing in the morning, if you're getting that sunlight that they say you should be getting, do you need to put on sunblock right first?
No, because you have some positive benefits from the sun. Vitamin D production, and there's other chemical reactions that occur that's actually good for you.
Yeah, well, the UV's really low in the morning.
Right. So some exposure is actually good.
Okay. All right. So now we're going to get into a different topic that a lot of our patients deal with. It's something that we treat here in the office, and there is a lot of buzz and a lot of questions around this, and it's Lyme disease. So as far as Lyme disease is concerned, it can only come from one place. Is that correct? Or is it just tick?
Oh, absolutely not. Absolutely not.
Okay. All right. See, this is why we need to talk about this, because I always thought it was just from ticks. So what is Lyme disease and how does one get it?
Yeah, it's what's called a tick-borne illness, but it's a spirochete. So it's a germ just like syphilis. Syphilis is what can come back. So it's a spirochete, it's like a corkscrew that can, when it gets in your body, it can go to any organ and cause inflammation and swelling. And the problem is when you treat it, it can form a cyst and live in your body for years. It can go inside the cell or can be outside the cell. So really you have to treat it 3 different ways to make sure it never comes back.
Oh my gosh. So when you're talking about traditionally to holistically, how do you can't just walk into an office and say, I have Lyme disease. You might know, but there's a lot of people that don't know that initially, correct?
Right. So for our new patient labs, if you, in Indiana, I would say everyone's been exposed to Lyme. I would say that the vast majority of all people in the Midwest have Lyme in their body. If your immune system's strong enough, it keeps it in check. Yeah. Just like you have all kinds of herpes viruses. Yeah. But those viruses are supposed to be there because your immune system's constantly working, protecting your immune system by having them working out. Yeah. So if your body's strong, then Lyme can be in your body. You have no symptoms at all. Okay, so there's a blood test that most doctors don't know about. It's the Lyme Western blot, which checks for 13 different bands. Rather, just a screen is their simple antibody test, which the average screen test by doctors in America is 10% accurate. The Western blot is probably 50% accurate, and basically Lyme is a clinical diagnosis. It's a blood test, not for sure. Even though you can spend more money, there's very high-tech labs out there that is much more accurate. But insurance company doesn't pay for it. And most of the time, if you see it all the time, if the classic symptoms of basic labs are abnormal, inflammatory markers are high, and they have nothing else, then it's often Lyme.
So do you think it's often misdiagnosed?
Oh, all the time.
Yeah.
Always.
That sounds pretty complicated. But
always.
Yeah. I mean, that just makes me think if you're going to a traditional doctor, you're probably getting treated for maybe 100 things before you're actually treated.
Right. It's usually 10 years before someone's diagnosed. Yeah. Okay. And particularly if a doctor's given up on you, we can't figure you out. Yeah. You're of chronic fatigue. And if they want to put you on Prozac because of all your symptoms, then you need to see a holistic doctor that's versed in Lyme. I say more and more coming to a holistic just because Lyme is a thing, and the CDC, I think maybe 10 years ago, they used to say 30,000 people a year. And then finally they went up to 300,000 per year. And now we know it's much more than that, cases per year, over 300,000. Yeah,
that's crazy. So as far as protecting yourself, what does that look like? You hear wooded areas.
Right. Wooded areas. Yeah, just be careful. That's the time you have to cover up. You can't go in the woods in shorts. Yeah. And you have to be a total nerd because the ticks climb upwards. So you actually put your socks over your pants, and it's amazing how that works. Yeah. So you're sure everything has to be tucked in so they climb upwards. It's a great idea to wear light colored clothes so then you can see that black tick. Yeah. But the more of the just like branches, like I was rolling the other day and I hit a branch. I come home and sure enough, I feel something crawling me and there was a tick. It's like that because, they are so smart. If there's they're just hanging out, the top of the grass. They're just waiting to get on the animal. Yeah. And to us, we're just another animal.
Yeah. Well, because they can sense it, right? I mean, they have those sensors to know when there's something more.
Absolutely. Yeah. Correct? Absolutely. No, they're sneaky little things. Yeah. and they crawl and hide. And so the main thing is cover up is number one. And southern Indiana, over half of every tick has been shown to have Lyme. So the Board of Health doesn't even check in southern Indiana anymore. You just right now, it's you just assume Lyme is everywhere. Yeah. So you just have to take care of yourself. And most importantly, once I've had Lyme. That's why I do what I do as I had Lyme. And I had at age 40, probably since age 8. My life could have been so much easier. But now, at my age, I feel the best I've ever felt in my life. Yeah. But it's something that is usually easily treated if people can follow the directions and make their immune system strong, along with getting rid of the ticks.
Yeah. So if you're bitten by a tick, are you guaranteed to have Lyme?
Absolutely not. Okay. No. But that was so you asked about I won't mention what state. So one state, a little bit west of us, did a study. 1/3 of every stinging insect in that state had Lyme. 1/3 of every stinging insect. Songbirds, a lot of them have it. Deer in the Midwest, more than half of them have Lyme. That's a major reservoir. Rodents can have it. So And so the study was actually retracted and hidden because it's a tourist state, and no one was going to this state anymore when they found that. But it's just that's just everywhere. It's not just that state, but the states will have the most ticks. Obviously, it's in the most animals. So you assume you're getting exposed to it. In fact, that's why. So I'm an outdoors person, so I get ticks on me despite having Lyme, and I have antibodies to about 10 different strains of Lyme in my body. Yeah. But because my immune system's so strong, then I don't care about it. So yes, I get ticks, but I make sure I check immediately when I get home, and I'll make sure I take them out. That's why you have good mirrors if you live alone, and make sure you check. And the private areas they go to, your belly button, your hairline, and it's better if you have a friend that can check you, and you can check them. Yeah,
before you get in your car or something, that's probably smart if you're out on the Monon.
Right. I would think just right. But in the city, in the lawns, it's definitely everywhere. I literally at one branch, and I'm sure I even thought about it's like there's a tin, sure enough, there's a tick on that branch and on that leaf, and I was crawling on my face that evening.
Intrusive thought right there.
Yeah, maybe.
You brought it on.
I did.
So same thing as sunscreen, bug spray. Is it just kind of the same?
I know, but we hate DEET. We hate it. We hate it.
Worst,
if you so. I try the top rated one, ticks and all, ticks, and then the number N or letter N, and then all.
Okay.
Yeah, that it works. As a insect repellent, it's all natural. I think it works great. Definitely put it on your clothes, and just being careful. So that's what I use.
Okay, and that does so that you just do that for all bugs.
Yeah,
in general.
But
I'll put that in the.
So if I'm hiking a long time, but normally I don't use anything. If I'm just going like for a 3-hour hike, and I'm have my if I'm properly dressed and I look for it, I don't think if you have to do it. If you're OCD, if you want to do it, I feel ticks and all is safe. But even with children, I'd be so careful with DEET.
Yeah, definitely. So someone comes in, they do all the blood work, they have Lyme.
Yeah.
How do we treat them here?
Yeah, so it depends how severe it is. If they actually have, swollen joints and fever, then I use IV ozone, vitamin C, and antibiotics. There is a place for antibiotics if it's more chronic or not severe. And some people just absolutely do not want to ever take antibiotics because, as you know, the gut microbiome, everyone worries about their gut. And, I've treated thousands and thousands of people for Lyme. The first 15 years, I could not find any experts on herbs back in the day. So I use antibiotics, and probably of 5,000 to maybe 2,000 people, 3 people developed inflammatory bowel disease, which I think was probably from the antibiotics.
Yeah.
And luckily they were able to get out of it, but that's something you don't want to do. So if someone, even if it's full inflammatory, if they're okay coming in for IV vitamin C and ozone and herbs, I can get people out of the woods, even with the acute inflammation. But I have no problem short-term doing antibiotics, and we use more high-dose probiotics, so I haven't had anyone develop inflammatory bowel disease from doing antibiotics. And I'd say probably 5% of my people need antibiotics, or if cost is an issue, all these amazing antibiotics are generic. So what used to be thousands and thousands of dollars, now it's like a lot of antibiotics are free these days.
Yeah.
So the cost of treating it is almost zero. And you mentioned you recently had someone pass that had MS and she was 20. We feel over 90% of all people with MS is Lyme. And so any of these degenerative diseases, Lyme is often associated with those diseases. So that's one of the first things we think about.
Wow. Oh my. So as far as Lyme goes, is it curable or just treatable?
Right. Just like we put it in remission. Because just like if you have Epstein-Barr virus that causes chronic mono, I put it in remission, but it will always be in your body like everyone else's. And with Lyme, I'm sure I've got many strains in my body, but maybe that's protecting me now because now my immune system's strong. So if I do get a tick bite, my body's making so many different antibodies that I will probably not even know I had it.
Yeah.
So it is something we say in remission. So the key is just to have your body so strong that your bodies can keep these pathogens in check.
Okay. Yeah. No, and the spirochete. I know this is going to be really up there, and I knew you were going to ask. What exactly is that when you're talking about a spirochete?
Yeah, so it's a bacteria that looks like, if you look under a microscope, it's like a corkscrew or What's it? Circulation? Is that corkscrew? Okay, yeah.
Yeah.
I'm trying to think when you do the wine and that little twist, it looks like that.
You can tell he doesn't drink very much.
I don't drink that, no.
Yeah, that's good. Okay, well, that's good to know. Anything else you want to cover for skin or Lyme?
Yes, people panic. They get a tick. They got this big swollen tick, and I remember my best friend's dad would take a cigarette, light it, and just burn the tick. Yeah, which trying not to burn our skin, right? Not the way to do it. Don't put alcohol on it. People try to torment the thing. Well, this thing's full. The germs, the bacteria is in its gut. So last thing you want to do is spew his content. When you squeeze that thing, it's injecting you into your body. Yeah. So I actually, in my briefcase in my car, the fine tweezers, I guess girls use it for the eyebrows. The best kind. But in my briefcase in my car. So some people always come to me. So the key is, if the more they're bedded in, it's a little bit more challenging. So I was my reading glasses with good vision. You find that head at least the head, pull it back, and then I grab, there's the two pinchers, so I grab one, pull it out, and then I pull the other one out. So I try not to even squeeze the head, but definitely you don't want to squeeze the body. You never do that. You can squeeze the head, but ideally grab a pincher of this one, pull this out, and just pull it out that way. But don't squeeze the body. Don't make it mad, because when you make it mad, you don't want it to vomit into your body.
That's good to know. That's good to know. That's horrible.
Yeah.
I feel like I'm watching like Alien versus Predator.
Well, I mean, if you look at these things under a microscope, they are scary creatures. They are.
Yeah.
And they transmit diseases. And within pets, everyone has pets around here. So if you have an outdoor pet, you need to check that. I didn't do research on that. There's holistic vets, but I would, do you give your animal something to repel ticks? I can't imagine that would be healthy for your dog.
Yeah, I know they have flea and tick things for your dogs, but I had my dog just passed away, but I had a long-haired dog, a Bernese Mountain Dog, and he was like 120 pounds. So especially after having kids, it was like I had to bring him inside, and every time I'd check, we lived in new development. I think that's a good thing to bring up too, is even if you live in a new development with no trees, I think people think, I don't have anything out here. You still should check your animals.
Yeah, because all the birds and all the animals bring them in. Yeah. So I would say even new addition, I'd be cautious.
Yeah, definitely. So as far as you pull the tick out, the tick's out. Do you still need treatment even if you don't know if you have Lyme or not? How does that look for people?
Right. Usually people call us and we just tell them, so where were you? How long was it on your body? If it was, you just went hiking, it was on your skin for less than 3 hours. There was some experts say, well, it's got to be on more than 24 hours. And we have people say that tick was on there for literally, it bit me. And you think about it, if someone's rabid, it bites you.
Right.
How many seconds does it take to get in your system?
Right.
So the duration, I'd say the longer, the increased risk, but still any bite for any amount of time, I'd still take it seriously.
You had mentioned earlier, even if there's no tick involved, you can get Lyme. How do you get Lyme if you've not been bitten?
Oh, right. So the larvae of these ticks are more contagious than the ticks, and you can't even see them. That's the problem. So I would say I usually don't even ask if they had tick bite. I just assume that everyone's been exposed. And whether it's manifest in you, that's for me to figure out based upon your symptoms and blood work.
All right, you guys, the whole month of July, we are doing a skin supplement promo on our website at our online store. The code is going to be SKIN25. So you'll get 25% off any of our skin supplements. I'll have them listed in the bio below. Thank you guys so much for listening, and we'll see you next month.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to hwofc.com or call 317-663-7123.